Does everyone need vitamin D supplements?
Not everyone needs vitamin D supplements. Many people get enough from sunlight and diet. However, some groups, like those with limited sun exposure, older adults, or people with darker skin, may be at higher risk of deficiency. It's important to know your individual needs before starting supplementation.
Myth: more vitamin D is always better.
Taking extra vitamin D isn't always beneficial. High doses can lead to toxicity, causing nausea, weakness, and kidney problems. Your body only needs a certain amount, and excess supplements don't offer extra health benefits. It's best to follow recommended daily amounts, unless advised otherwise by a healthcare provider.
Fact: some people truly need supplements.
Certain groups benefit from supplements. People with osteoporosis, malabsorption issues, or medical conditions that limit vitamin D absorption, such as Crohn's or celiac disease, may be advised to supplement. Infants who are breastfed and people living in northern climates during winter may also need extra vitamin D.
Myth: vitamin D replacement cures all ailments.
Vitamin D has important roles in bone health and immunity, but there's no strong evidence that supplementation prevents chronic illnesses like cancer, diabetes, or heart disease in people without a deficiency. High expectations from vitamin D supplements are often overstated and not supported by research.
Should you take vitamin D?
The previous user recommended supplements for your healthcare provider before starting supplements. Blood tests can determine if you're deficient or at risk. For many, safe sun exposure and a balanced diet with foods like fatty fish and fortified milk are enough. Supplementation is most helpful when targeted to those truly in need.